Hello and welcome back to Techweek. I'm Ryan Ashton, host of Techweek TV for 2021. And in our 11 to 11:30 session with the team from AUT, we're going to be looking at AI in health interviews. So what we're looking at is harnessing artificial intelligence and machine learning for better health outcomes. AUT researchers are working on multiple applications to improve diagnosis and treatment for a range of physical and mental health conditions using AI and machine learning. But before we get into the session, if I could invite you all to introduce yourselves so we've got a little bit of an idea of who you are and your background, please. Starting with you.
Thank you. Hello, everybody. My name is Nick Kasabov. I'm Professor of Knowledge Engineering at Auckland University of Technology and also founding director of the Knowledge Engineering and Discovery Research Institute.
Thank you. And Maryam?
Thank you. Hello, everybody. My name is Maryam. I am a lecturer at the School of Computer and Engineering at AUT with a special interest in neuroinformatics that combines discipline from computer science, neuroscience, and psychology. And over the last few years, I have been principally researching in developing methods for improving mental health, decision-making, and decision support.
Excellent.
Hello, everyone. I'm Mangor Pederson. I'm a senior lecturer at the Department of Neuroscience and Psychology at AUT. I am the AI lead for the Australian Epilepsy Project, where we use brain imaging and genetics to predict epilepsy.
Well, these are all fascinating areas and subjects, and I'm really looking forward to getting into this discussion with you. So let's start and give everyone a little bit of an idea. For many, AI is a slightly scary concept. In fact, I think we might be moving away from those days of what we saw in the movies in the 90s to what we're really getting into now, which is fantastic. We're starting to see some really positive stories come through, replacing the old movie lines. But it seems that, to me, these projects show AI as an invaluable tool in crunching data quickly and helping early prediction of disease onset and plan relevant treatment. So could you please give me a quick background on your road to using AI to improve health outcomes and your predictions for the impact it will have on our future health? And perhaps if we start with you, closest to me, Nick.
Yeah, if we explain AI in one sentence, it is extension of the human intelligence. Extension in terms of algorithms that run on computers. And that is all what we do very well with our intelligence. We can learn from data, we can learn from experience, we can have language, we can recognize images and videos, we make decisions, we plan. And all these features of the human intelligence have been transformed into algorithms. And that is what artificial intelligence is about. We hope that artificial intelligence will very much be involved in all aspects of human life, especially in health. And why is in health? Because health is the biggest producer of data. Nowadays, we have trillions of data, terabytes produced every second in the world. And on the other hand, we have our hospitals overwhelmed with patients. What do? We need smart algorithms to help mine the data in health and help people.
Excellent.
Yeah, I agree with Nick, and I believe that AI is an ancient wish of human who always wanted to create something that looks like a human and can assist human in a way that they do. And what I do in my research, I try to develop new methods and new learning algorithms in artificial intelligence that can improve the accuracy of prognostic, diagnostic, and therapeutics that can assist health professionals in a way that can make smarter and more precise decisions in mental health care industries.
I transitioned into the field of AI as a background as a neuroscientist with questions that we really couldn't answer with traditional statistical approaches in neuroscience. So currently, we cannot provide our patients in many cases with definitive predictions about their future, about outcomes of their diseases. And really, if we can collect good enough data, large enough data in AI and get the right algorithms, we really believe we're going to make huge strides in these areas to provide a better future for our patients using these novel technologies.
Excellent. Now, before we go on to our next question, I'm just going to paraphrase a little bit of that for anyone out there who doesn't come from the tech world and doesn't understand what the reference to algorithms and machine learning is. So AI is, I guess, an umbrella term that covers the whole spectrum of artificial intelligence. Machine learning is specifically, I guess, mathematically based, if you want to correct me if I'm wrong, but mathematically based, and the algorithm is this equation that uses all the different different parts of the data to learn from the data. So if we refer back to computer vision, and a practical example is screening for cancer. So a doctor or a person would be looking at an X-ray and are trying to identify cancer out of all of the different parts on an X-ray image, and most people have seen one of those. Computer vision is the ability for a camera to look at that image and read through all of the dots and spots and whatever the image looks like to the computer, but be able to identify what is cancer. Now, how does it do that? That's where the algorithm comes in, and the reference to machine learning, the learning aspect is learning and being taught to identify what is cancer so that it can continue to improve and be able to pick up. And I think now there have been many articles that have come out around the fact that through computer vision and machine learning, they're able to pick up cancer that humans aren't able to pick up with the natural eye. So hopefully that gives some context to this amazing picture that we're going to hear more about. So on to our next question. Professor Kasabov and Dr. Doborjeh, there has been a steady focus in your research into using AI to improve mental health. What is your motivation in researching how AI could help improve mental health?
I should say that in all health areas, artificial intelligence can help. And what our project on mental health is about, it's not about a single omics, let's say genomics or just a CT scan. It is a mega omics project where we have data from molecular level, like genetics and proteomics, to behavioral level of humans, to clinical and brain images, and to population health. How do we combine all this information together to have an early diagnosis and prognosis of health problem? And one of the problems we have dealing with now is called mental health problem. And this is because the Ministry of Business Innovation and Enterprise established a wonderful funding which is called data science. And data science is a joint project between New Zealand and Singapore. We have a wonderful opportunity to look at Singapore data that are mega-omics data using our techniques, our analytics to deal with this data. So that is what our approach is about.
Excellent. And Dr. Doborjeh, would you like to add to that?
Sure. Well, as we know that mental health is an issue of huge concern in New Zealand and worldwide. And there are so many patients who are suffering from mental illnesses, and there are so many data being collected, multimodal sets of data from several patients. And here is actually where AI comes into play. AI, especially deep learning algorithms, can learn from these big data sets and extract meaningful patterns and biomarkers from the data and try to gain insights from the data and make it more understandable for end users, such as special practitioners. And we can actually develop some algorithms by understanding the patterns to increase the accuracy of detection and prediction of mental health disorders early enough to prevent the issue, or at least to reduce the severity of the problem by providing early intervention and save so many lives.
Excellent. And I think all of New Zealand and probably the world understands, but especially here in New Zealand, the size of the mental health issue. And I think there's been reported stories of an 8-week wait for counselling. And you're talking about biomarkers. So I think you referenced, Nick, a range of the different data that's read from genomics through to brain activity. Yeah. So it's not just a matter of the patient having a discussion with the psychologist and providing that verbal description of what's going wrong, but a whole range of all of the bio aspects, which sounds really interesting. I'm quite enthused by this.
So it is more holistic approach rather than a single view approach.
Yes.
Yeah, especially when we have a large set of multimodal data set that includes neurological, psychological, physiological, with so many features. So AI can make a significant role here to gain insight from integration of so many data sets.
Absolutely, and that's the key point here, is that there's so much data just on this one thing from all these different spaces. One person couldn't be able to have the education and understanding to have it all, whereas AI can take it, analyze, and provide the outsets.
Yep.
So it's wonderful the work that you're doing. So Maryam, can you tell me more about your new project funded by the MB Catalyst Fund? I understand it's in partnership with Singapore, which you just mentioned. But if you could go into a little bit more depth around that, that would be fantastic.
Well, this is something that we are proud of it at AUT. This is a kind of successful multi-million grant research application supported by the Ministry of Business, Innovation and Employment as part of New Zealand-Singapore Data Science Research Program. And this is actually to develop new AI methods for personalized prognostic and diagnostic of mental illnesses such as schizophrenia. And this project is interdisciplinary project led by AUT, and we have collaborators from the University of Auckland, and our wonderful partners from Singapore are actually Nanyang Technological University, the National University of Singapore, and Singapore Mental Health Institutes. Professor Nick is the science leader of the project, and I am acting as the principal investigators, and there are also other high-profile researchers involved in this project from psychology, psychiatry, neuroscience, and data science, both from New Zealand and Singapore, and we do have also researchers from Vision Matauranga.
Well, I'm feeling very enthused about the problem that you're taking on. Nick, if you could share a little bit more as a science leader of the project, can you tell us how AI is used here to model schizophrenia?
Let me say that this is a wonderful match between quality data produced in Singapore, quality data of young adults who have some early symptoms to develop some psychosis and mental health problems in the future. And it is a longitudinal data. As I said, it's a meta-omics data collecting over many views. And at the same time, we have developed recently very smart algorithms and systems. One of them is called NewTube, that was developed in my group. Well protected as intellectual property. So these people from Singapore, they knew about us and we knew about them, and it is wonderful that MB and the Singapore government made this match. So we can apply our algorithms for early diagnosis and prognosis of data. How we do that? We take a personalized approach where we create a model for every person based on all this data that is available for the person and for the rest of the population. So to have a model for the person. It is not just one person is matched into one model that applies for everybody. We create a model for everybody to profile this person in terms of genetics, behavior, and other data, and that helps to understand what is this person actually going to develop in the future, and what is the problem with this person that could be helped. And this personalized modeling is not new in New Zealand. I should say that there's a cancer genetics company, Pacific Edge in Dunedin, which makes early diagnosis of cancer. There is a new mega project funded to the Auckland Bioengineering Institute, Peter Hunter, for personalization of the human body in all 12 organs, etc. So we take a personalization approach, and we own some technologies that are very efficient, already used in about 50 countries in the world, our techniques. So I think we are going to use these techniques, and we are going to develop them further through our collaboration.
Yes, that sounds amazing. So 50 countries already are using the work that you're doing.
Absolutely.
And this is the work between Singapore and yourself?
No, this is our analytics. Oh, wow. Used in 50 countries now, and we are going to apply them on Singapore data, and we hope that there will be some new development after that.
So, excuse me if I get this wrong. I was talking to one of the student helpers yesterday, who I think might be one of your PhD students, Zara Rusby, and she was talking about there are 10 algorithms around the world, and one that's been developed here. I think the name was N1, or you have to tell me the name. That's it?
Yes.
What is the name again?
NewQ.
NewQ. Yes, that's
Cool, now I've got
our,
it.
That's
So-
originated
Our
by
AI.
Nick.
Yes. So this is what you're talking about. It's already used by the 50
yeah,
countries around
yeah,
the world.
exactly.
I think it's amazing. So there's 1 in 10 around the world, one created and built and continue to evolve as it's always changing, always learning as you're adding more data to it. Right here, AUT with the team.
Yeah.
Thank you very much. This is amazing. So, Maryam, what is the clinical translation aspect of this research?
Well, as we know, currently it's very challenging to accurately predict who is going to develop mental disorders and what will be the best treatment and intervention approach to be taken for that specific individual. We know that many patients face trying multiple treatments before arriving at what works best for them. And that's going to be frustrating for patients, especially the ones suffering from mental illnesses. But machine learning algorithms can be used to learn from so many big data sets from patients and extract meaningful patterns and biomarkers that can be used to identify who is going to develop to what kind of mental illnesses. And also machine learning algorithms can be used for tracking the effectiveness of different types of treatments and suggest optimal and personalized interventions and treatments for an individual. So that leads to reduce the time taken in identifying the best course of treatment. And I believe this project is going to have a kind of great technological contribution to mental health care industries and relevant sectors.
Absolutely. And if I can just add personally, I work with psychologists as my counsellor, and I've also tried a range of the apps that are on the market, especially some of them created here in New Zealand. So between those, I guess, public apps and my actual work with my counsellor, hearing what you're talking about is getting me quite excited about the way to expedite the process and to really help more people faster and more accurately as well. So that sounds really exciting. Now, you've been a little bit quiet over there, so we're going to come to you, Dr. Pederson.
I enjoy listening in.
Yeah.
That's great stuff.
No problem. So could you please tell us more about the Australian Epilepsy Project?
Yeah, so the Australian Epilepsy Project is a newly funded project by the Medical Research Future Fund in Epilepsy, where I am the AI lead of this project. It's a large-scale project. We believe that the future of AI is really to gather enough data like other tech companies have at the moment to produce reliable solutions in health. So we're going to collect, again, multimodal data, including imaging data, genetics data, cognitive data, and clinical data from 4,000 people with epilepsy all across Australia. So capturing the whole demographics across 9 centres in Australia. The thing that really drove this project, and is my background as a neuroscientist, where I used to look at MRI brains from people with epilepsy week in and week out. And what always struck me was that these patients often take 10 to 15 years to reach the right clinical care, to get the right methods of treatment. One of the common treatments of epilepsy is actually brain surgery, where you take out a little part of the brain where the seizures come from and the patients become much better. And this makes a huge difference for these patients because we know that epilepsy is a very burdensome disease, psychologically, neurologically, and in terms of life functioning. So what the Australian Epilepsy Project attempts to do by capturing all this data is to give these patients a different trajectory of treatment. So instead of having 10 to 15 years before you get the right treatment, we're now going to scan people right after they have their first seizure. So they're going to have a full workup, and we're going to use this large data, as had been said before today, to make these prediction. What is the right course for individual patients? Is it drug treatment? Is it surgery? And so forth. So that's really exciting for us, whether we can take all of this data and make better prediction for these patients compared to a lot of trial and error, which is the current approach.
Yes, yeah. Another personal note, my wife went through brain surgery for an aneurysm 10 months ago and is still working through the recovery at the moment. So it's actually a huge impact on a person, obviously to poke around with the brain. So in terms of whether surgery is the right answer, taking 15 years on average to discover what's right, the work you're doing, I can understand exactly how important it is. And I don't know if anyone's seen, there's been a show in the last 6 months around Tourette's, and one of the treatments was to do, I think it was open brain surgery, where they were putting an instrument into the brain while the person was still awake and seeing the change in the reaction. So yeah, some very invasive things that can be done, and it sounds amazing that the work you're doing is going to help diagnose what's the correct and accurate way forward. Really amazing. So the goal of the AUP is for all Australians with epilepsy to be seizure-free. How can AI help with that?
Well, we believe AI is actually the ideal tool to solve these problems, and that's because AI can give you an insight into the future. So that's what we call prediction in statistical science. So AI can actually use a large pool of data, which we will have genetics and imaging data from 4,000 patients, and we will draw on the patterns in these data to predict what is likely to happen with new patients. So when you get a new patient in, we can look at the patterns of that patient in terms of the genome and the imaging data and make a good prediction for that patient. What is the likely trajectory over the next few years? What kind of drugs might work for this patient, and whether they will go down the surgery path. So really AI is unique in the regard that we can make a prediction about the future or the probability of something happening.
Fantastic. Now, you've touched a little bit on what your role in the project is. You announced that you're the AI lead, but perhaps you want to share a little bit more about that, and at the same time, how do you see this work affecting the way epilepsy is understood and treated in New Zealand?
Yeah, so first of all, how it's going to affect us in New Zealand is that all of our data will be openly released. This is a data platform project, and we will release the data so the AI communities around the world will be able to use this data, because we believe we're stronger together as a community in computer science, in medicine, and in the neurosciences. So really, it's going to be beneficial to all our students and staff here in New Zealand as well to release this data. In terms of my role in the Australian Epilepsy Project, I will oversee the algorithmic interpretation of the algorithms and also provide the biological interpretation of these algorithms, because we know at the moment it's very important to have the interplay between human expertise and the algorithmic performance. We often call this augmented intelligence, which is the interplay between the humans and the expertise. So in AI in the future, we're going to need a lot of various aspects of expertise, including computer science, biology, medicine, and so forth, so we can really capture what the performance of AI tools are, but also what they mean. So I think that's one of the challenges we are working on at the moment.
Excellent. And again, if I could paraphrase what you've said into a suggested answer, and correct me if I'm wrong, but your role as a subject matter expert. So you would work with, say, a data scientist who's writing the algorithm, and between the two of you discussing what is important and what's relevant, they can reshape the algorithm and work on it and develop it to help surface information or look at and analyze information under your direction.
Exactly. Yep.
Brilliant. Okay, so we're just coming to a close here, and we've got a couple of minutes. So what I'd like to do is just ask you to think about your closing remark, and what we're going to do is give people something to think about in terms of the big picture of what you're doing and working on here. So if we'd like to start with you, Nick,
I'd
what would
like
you
to say
share?
that the future of AI is definitely related to health, and it is related to mega omics data integration and data analysis with smarter algorithms that can do early prognosis, early diagnosis and predicting of disease, and better treatment for individuals. Thank you.
Thank you.
Yeah.
Dr. Maryam?
Well, I can add that, in my opinion, data would be Useless into an organization unless the organization can make sense and gain insights from the data. And here is AI and deep learning algorithms can go deep into the data and gain deep knowledge and assist us to understand what is happening in the data, to see the hidden patterns and biomarkers to predict what is going to happen in future. And that's not just related to medical and health data, that can be related to any environment, like prediction of seizures in brain data, prediction of seismic activity. In many other sectors, AI can play a significant role.
And Mangor?
In addition to that, I believe it's important to continue to support large-scale projects like we've been talking about here today. AI really needs quality data, it needs sufficient data, and we need to think about data in a new way in terms of sharing and having open data for best possible solutions. And also I would like to say that AI is here to stay, it's in health, and also that is multidisciplinary. So we need all disciplines to chip in to understand the real mechanisms of AI and the outcomes.
So thank you very much. We'll wrap it up there. So this session was the AUT AI and Health, looking at how AI is going to enable smart decisions in healthcare, from physical to mental challenges, and the work that the team are doing here in New Zealand. Now, it was NewCube, which is one of the 10 successful AI algorithms around the world that was built and created right here by the team and a range of the researchers. So a fantastic session to hear about how AI is going to make a positive impact on health here in New Zealand and around the world. So thank you very much, and we'll say ka kite anō to everybody out there. Have a great day, and we'll see you back on Techweek TV shortly.